welcome to our presentation. Our topic is about nano-hydroxyapatite and its uses and benefits in dentistry. Without further ado, I will give the floor to our first speaker.
Okay, so some of the history from nano-hydroxyapatite is that nano-hydroxyapatite has actually been around since the 1950s, and it actually wasn't used medically until the 1970s by NASA astronauts when they returned from missions due to significant loss in teeth and bone mass. So Shanghai Company in Japan was the actually introduced nano-hydroxyapatite as the main ingredient in enamel remineralization toothpaste, and nowadays is actually used in orthopedics and dentistry. So in order to understand nano-hydroxyapatite a little bit better, we want to discuss the tooth anatomy. So a tooth's outermost layer that covers the crown portion is made up of enamel. It's made up of mainly hydroxyapatite and it does not regenerate, which is actually made out of 97%, which you can see in the chart below. And the second layer is dentin, which has the ability to regenerate at a microscopic level, but cannot heal fast enough to compensate for the decay caused by bacterial byproducts that are also going to affect the pulp, which is actually going to be the innermost layer, which is going to contain blood vessels and nerves.
So what causes decay? Decay is caused by demineralization by reaching a critical pH level lower than 5.5. This is caused by bacteria breaking down organic compounds such as sugars into acidic compounds such as lactic acid. The lack of proper oral hygiene allows for numbers of these microorganisms to flourish. So how is decay prevented? First of all, biologically, by our saliva. They have minerals like calcium and phosphate to help replace minerals lost in the demineralization process. Secondly, chemically, with additives like fluoride and nano-hydroxyapatite. Thirdly, mechanically, by brushing, flossing, and antimicrobial mouth rinses.
So some of the differences between nano-hydroxyapatite and fluoride is that for nano-hydroxyapatite, biomimetic does not require saliva as it already contains calcium and phosphate, allowing it to easily integrate into teeth structure. So one of the major things is going to be that it penetrates deeper layers than fluoride, making the teeth more resistant to acid. And it also doesn't have a toxicity level, whereas fluoride has a toxicity level if it's ingested in higher doses. Fluoride is applied and it creates a film that attaches to the tooth structure and it attracts calcium and phosphate in the saliva to remineralize any areas affected by acid. So demineralization occurs when the enamel and dentin hydroxyapatite is broken down, losing their calcium and phosphate. If the hydroxyapatite is partially demineralized, then this process is reversible if quickly exposed to favorable oral environments, allowing for remineralization in different sources, which are listed. In dentin, nano-hydroxyapatite penetrates demineralized collagen matrix, acting as a scaffold for remineralization and providing a calcium and phosphate source locally.
So desensitization and anti-hypersensitivity characteristics. In picture A, you see exposed nerve endings inside dentinal tubules and how external stimuli interact with the tooth's nerve endings. These stimuli can be from bacteria, acidic foods and beverages, and sudden temperature changes. Picture B depicts occluded dentinal tubules, which I will further elaborate in the next slide. So here are 3 photos taken of dentinal tubules in different aspects using a scanning electron microscope adopted from the Journal of Dental Research. I'd like to bring your focus onto picture B and C because they show how nano-HA fits into and effectively seals the dentinal tubules. Picture C demonstrates the depth that nano-HA penetrates into the tooth structure, which, as mentioned before, is much more effective than fluoride, which sits mainly on the surface of teeth.
So implants and nano-HA. Nano-HA coatings have been used to improve osseointegration of dental and orthopedic implants. HA itself has osteoconductive properties, increasing osteoblastic activity. An implant made entirely from HA itself is not strong enough to withstand mechanical load, but when nano-HA coats titanium, it provides strength to withstand mechanical load and the biocompatibility for success.
All right, nice. And that concludes our presentation. Here's a page of our sources if you're interested to know more about nano-hydroxyapatite. Thank you for your time and floss it
Floss it up.